you're not going to know everything on the Nclex. So when you're preparing for your test, you're trying to study each and every single topic and understand, the causes, the symptoms, the treatments. You're not going to remember all that, and you're gonna study too much and burn yourself out. So come Nclex, you're not going to know everything. I was trying to learn everything about OB, farm, cardiac, endocrine, you name it. You can't study and account for every single topic. That's just impossible to do. But the way the Nclex works is it's an adaptive test, and it's going to adjust based on your answers in those first 10 questions. So those first 10 questions, you might not know any of it, but it just wants to know if you're a safe nurse and will you make the right decision, the safest decision to practice as a nurse. So like in Mark K, which I recommend all of you guys to watch, episode 12, he teaches you how to prioritize certain question options. So, like his big thing was acute versus chronic. You're not going to go pick a chronic condition over an acute. You're always going to pick an acute. So like when you're taking your test, it might throw three different chronic conditions at you that you might have never heard of, and then it'll say acute whatever it is. You're going to go with the acute question, just like Marquez said. So I don't think you should know everything coming into this test, but you have to know how to answer these questions and understand how the NCLEX works. And if you can understand how the NCLEX adapts and will ask you these questions, and you can learn how to answer these questions the way the NCLEX wants you to, then you're going to do great on this test. But if you can't, then you're going to fail. But if you listen to those Mark A lectures and you listen to that episode 12, you're going to do good, because I feel like you can go into this test not knowing anything, not literally anything, but like you can have the slimmest amount of knowledge about a topic and still do good because you know how to answer those questions. And then that's all you really need to do, because I was concerned about OB, farm, cardiac, you name it. You're not going to know everything. I didn't know everything, but I knew how to answer those questions, and that's how I did good.